Another sad record in France, where more than 41,000 coronavirus infections were reported on Thursday. In some cities, intensive care units are already reaching capacity. A public health crisis looms large. The government has responded by extending curfews already in effect in the capital Paris to a total of 38 regions. France is set to become the second European country to exceed 1 million cases, after Spain reached this grim milestone earlier in the week. With an infection rate 3 times the national average, the region of Navarra has resorted to drastic measures. It has banned most travel into and out of the region and closed all restaurants and bars. The capital, Madrid, has been under a similar lockdown for the past 2 weeks to stem a spiralling caseload. Italy was the first European country to be hit hard by the coronavirus. Prime Minister Giuseppe Conte has appealed to Italians to adhere to curfews imposed in Italy's 3 biggest cities. The country is desperate to avoid the massive casualties and overflowing hospitals witnessed earlier this year. The caseload is exploding in the Czech Republic. A record 15,000 new infections on Thursday prompted the government to impose a hard lockdown. Prime Minister Andrej Babiš said the health system would otherwise collapse by early next month. As shops shuttered in the capital, Prague, the army moved in to set up a field hospital. A lockdown is also in effect in Ireland. Over the next 6 weeks, households are not allowed to mingle and people have to stay within 5 kilometres of their homes. Non-essential shops have been closed and restaurants are restricted to takeaway services.
Well, COVID-19 has wreaked havoc on health systems globally, but especially in 4 geographic hotspots. There are well over 8 million cases in the U.S., 9 million in Latin America, 4 million in Europe, and more than 7 million in India. We can get an update now from 3 of those different regions. Correspondents are standing by in Rome, Beijing, and Delhi. And I'm going to go first to Seema Gupta, who's standing by in Rome. Seema, we know that Italy hit very hard in the first wave of this pandemic, one of the highest death tolls in Europe. What is the situation now?
Well, what we're seeing is we're hitting records in terms of new infections daily. Just in the last 24 hours, more than 16,000 new infections. But it's important to note that they're also carrying out way more tests now than they ever did back in that first wave in the springtime. You're also seeing 136 deaths in the last 24 hours, a grim figure, but it doesn't compare to the highs of 900 deaths daily that we saw back again in spring. If you look closely, though, at the admissions into the intensive care unit, that figure is creeping up. You now have about 992 admissions for COVID-19 cases. So the region that was hardest hit back then, Lombardy, it still is counting for the most in terms of the number of infections. And the governor of that region saying today that the situation is dramatic and they've made the decision to reopen that temporary COVID hospital that was set up in the Milan fairground. A curfew has been in place in Milan and the surrounding Lombardy region from Thursday. And here in Rome and the surrounding Lazio region, from this day onwards, there's going to be a curfew this evening from midnight till 5 a.m. in the morning. So back again with those self-declaration forms.
Seema, thank you so much. Over to you. And Matthias, you're standing by in Beijing. Unlike Europe, China appears to be containing cases there. Why no second wave?
I think the reason is, first of all, technically that they have a lot of testing capacities and they're cracking down very quickly on any new outbreak, quarantining people and testing masses of people. I think the main difference between Europe and here is that after things got out of hand in January in Wuhan, the government decided to take a hard line and to eradicate, to bring the cases down to 0 and not to try to mingle through with having them below the infection a rate of one or any other targets. So they really waited this out until there were no more cases. And whenever something appears now,
Right.
they identify them quickly. They're very alert. People are still very scared of what might happen. And the borders are closed, so no new infections come in via travelers.
Matthias, thank you so much to you. Over now to Delhi, where Manira Chowdhury is standing by. Manira, overall, the cases are relatively high there. The numbers, however, are coming down. Has India reached its peak?
Well, going by the official numbers given by the government and the reports that we are seeing, they seem to suggest that India may have crossed its peak in the mid of September when we were showing over 90,000 cases per day. So India's peak having been crossed might be one of the reasons why we are seeing a declining trend. But there was also concerns that India might be testing low because in the week immediately following that peak, there was a slight dip recorded in the number of tests. So there were concerns regarding that. But that number also picked up. So now experts are suggesting that apart from the peak having been crossed, another reason to which the declining trend can be attributed to is that India may have a better working system of quick testing, tracing, isolation and hospitalization of cases which can get worsened. But again, India is a country with huge population and a high population density, so we are still showing over 50,000 cases per day. But the declining trend, it's important to note, can also be seen in parallel with the increasing recovery rate. And as far as the daily life is concerned, it's more or less has returned to normalcy. Reportedly, it's clear that we may not go back to a lockdown situation because it has huge economic costs. But the ongoing festive season and the approaching winter season is giving flames to the concerns that we may see a bit of a rise in the number of cases again.
Manira Chowdhury there in Delhi, Matthias Bollinger in Beijing, Seema Gupta in Rome. Thank you so much to all of you. And here is a look at some other developments in the global health emergency. The United Nations is urging the G20 group of leading economies to work together to fight the virus. Secretary General Antonio Guterres says that it's disappointing there was no coordinated action in March. South Korea has confirmed 155 new cases, its biggest jump in more than 40 days. Most of the infections have been traced to hospitals and care homes around the capital, Seoul. Australia is easing the cap on the number of residents allowed to return each week. The limit will rise by nearly 300 from next month.